Sir, thank you so much, sir. So nice of you. Sir, I will give you a brief presentation about whatever has been spoken by the Honorable Chief Secretary and the Minister Saab and the SES. This is just a data brief on the Balochistan. Balochistan, we all know that is a province of 15 million people, and it has, as told by SES, 50% the young population, which is below 15 years of age. This makes that we have a youngest population, and 70% of the population is dispersed in the rural settlements, which makes maybe the templates for the nation may not be applicable here, and we need a design context-specific models for social intervention for the service delivery. We all know that the Balochistan is the biggest province, and that makes the service delivery cost quite expensive and logistically quite difficult as well because of the vast geographical distribution of the province. Moreover, while income poverty is 40% of the people are living below the poverty line, but 60% are facing the different deprivation, which includes in terms of education and health and living standard. While we all know that this is the human capital index, which is the composite index for education and health and living standard. If we closely look at this, Pakistan is already at the origin of this HCI, but within Pakistan, Balochistan is just 0.32, which means that if a child born today, he or she will be only 32% productive. Had she has given opportunity of good health and good education, this is a 68% loss of human potential, human born potential. This is the state of affairs. When it comes to education, there are two gaps. One is the access gap and one is the learning gap. The government of Balochistan in last 2 years have done wonders as far as the access is concerned, but learning gap still persists. 58% of the childs who are in the school age, they are out of school, and adult literacy is just 45%, and whoever makes to the education, only 40% complete their primary education, and the learning gap, just 25% of people who can just do the basic mathematics. It means there are serious foundational learning issues we are facing currently in the Balochistan. Same is situation with the health. Our universal health coverage is just 39%, while as told by the previous speakers, national average is 54%. It means we are facing serious issues vis-a-vis health is concerned. The immunization rate and the skilled birth attendance, they are also very below as compared to the national and international standards. This is a very serious issue. Almost 50% of our child are facing stunted problem, 9% are wasted, 31% have underweight, and 71% are anemic. This means while only 39% of the children are developmentally on track, again we are losing the human capital vis-a-vis education and health indicators are concerned. These are some of the safety gaps. On average, 60% of the child, they have to leave their home to get safe drinking water. 60% of the child, they have to leave their home to get a simple basic need of water. And as far as the child labor is concerned, 9% childs who are in the school age otherwise, they are engaged in the work, and the ladies, the girls of less than 18 years of age, 22% are having a child marriage issue. This is again going to the early marriages, population growth, and all these issues, and health and malnutrition and the maternal mortality rate, they are all interconnected when it comes to these gaps. As I told you earlier, the government of Balochistan has done beautifully well in the last 2 years. We have opened almost 3,800 new schools, new teachers have been recruited, health professionals have been recruited, and 97% of schools have been made functional in the last 2 years. 97% of the schools have been made functional in the last 2 years. And the government of Balochistan, when it comes to women development, education and health and skill development, youth, in all areas, Government of Balochistan is investing almost 300 billion rupees. And we are at the moment more engaged in more than 963 development projects which are focusing the social sector, be it maybe the education and the health and the skill development. And this is our own money. I will talk about the donors' participation in the next slide, but this is the government-owned indigenous money and indigenous effort focusing on the social sector and the social protection. And this is the partnerships. I mean, we are partnering with so many organizations, some of which are listed on this slide, almost $800 million, and we are engaged in the 33 development projects, and that include the water scarcity, and education, health, social sector, and the livelihood, entrepreneurship. So all these partners are coordinating with us. We have been in close coordination with them, and we really value this partnership. But still, as I told you, there are some deficits, the serious capital deficit when it comes to education and then when it comes to health and social protection. And we need to indulge in further partnership which makes these gaps fill easily. These are some of the key areas for future collaboration, and this includes, as we all know, this is social protection theme, social and education, the nutrition, and the wash facilities, the child protection, and the institutional and the capacity building. And all these are the areas which I request all of you to come and collaborate with us and partner with us so that the 68% loss of the human capital, we could tap it and we could convert it into productive people for the next decade. As I told you in the first slides, that Balochistan is a province with 50% of the youngest population, and we have institutional commitment. The government is committed to tap this potential. What we need is to come to Balochistan, invest with us, partner with us. We should share our knowledge and expertise, and so that we could complete this issue as compared to the child labor, as compared to the marriages, as compared to the malnutrition and health. So we all welcome you to collaborate and come with us to achieve our shared development goals and to resolve this social problem. Thank you so much.